Life's podcast, where we empower caregivers with the support, resources, and inspiration they need. I'm Shiva Sambandam, and Lift Life was born from my own experience caregiving for my quadriplegic aunt. In each episode, we dive into expert interviews, real life caregiver stories, and share valuable insights, assistive technology, medical advancements, and much more. Whether you're a full time caregiver, a family member, or someone who simply wants to support the caregiving community, this podcast is for you. Today in our episode, we welcome Dr. Mark Gormley as our guest speaker. Dr. Gormley earned his medical degree from the University of Louisville School of Medicine in 1987. He completed his residency in physical medicine and rehabilitation at Tufts affiliated hospitals in Boston and further specialized with a fellowship in pediatric rehabilitation medicine and traumatic brain injury at the University of Michigan Medical Center. Since joining Gillette in 1993, Dr. Gormley has focused on treating children and adolescents with cerebral palsy, brain injuries, spinal cord injuries, neuromuscular disorders, and other conditions, with a particular interest in spasticity management. He is board certified in pediatric physical medicine and rehabilitation, underscoring his commitment to providing specialized care. Beyond his clinical work, Dr. Gormley serves as a trustee on the board for United Cerebral Palsy, one of the largest health nonprofits in the U.S., advocating for individuals with disabilities and their families. In this episode, we'll delve into Dr. Gormley's extensive experience, discuss the importance of rehabilitation, and explore how caregivers can access the right support for their loved ones. So let's dive in. Welcome to Lift Life, where we help caregivers not just survive, but thrive. Welcome to the episode, Dr. Gormley. Can you tell us a little bit about yourself?
Sure. So my specialty is pediatric physical medicine and rehabilitation. And so what I do is I'm a physician. And so I take care of kids with disability. The most common diagnosis that I deal with is cerebral palsy because it's the most common disability in childhood in the United States and worldwide for that matter. I deal with other conditions as well. And so what I do is I try to help the medical management. I make sure that they have all the different opportunities to maximize their level of function and their ability to participate in the community and live their life to their fullest. So I work very closely with various therapists, orthotists, other medical specialties. I help with managing their equipment and their bracing, and I do medical evaluations, and I do medical treatments such as botulinum toxin injections and other types of interventions. And then I help manage a lot of their medical issues along the way.
All right. So, can you tell us more about what you do for this community as a physician?
So kids with disabilities are very complicated. They have a lot of medical needs. Those medical needs change over time as they grow and develop and become adults. And so you got to work with a team. So is our function. I work at Gillette Children's, which is in St. Paul, Minnesota. It's actually the oldest and largest children's hospital that specializes in children with disabilities. And I'm honored to be surrounded by a wonderful team of experts that focus just on children with disabilities. And so with these kids, they're very tough and they can be very difficult to manage. And so you need a lot of eyes and a lot of expertise participating in it. So I work closely with various different therapists and nurses and orthotists and physicians and all kinds of different specialties that are involved, psychologists, and it goes on and on. The list would take you your whole program. But we work together very closely to try to optimize their ability to function as best we can.
All right. So more on Gillette's Children's Hospital. What's your day-to-day schedule like at the hospital?
So my day-to-day schedule varies. It depends on the day, depends on what I'm rotating. So we tend to rotate in different services as we go along. So some days I'm spending my time on the rehabilitation floor, managing the patients that come in that have had significant injuries and need rehabilitation before we're sending them home and trying to figure out how we're going to manage them and do the best we can to get them home. And so some days I'll be doing that. I work in clinic, and so I see patients that come in and out of clinic and evaluating them and making sure that they're doing okay and prescribing medications or treatments that may be appropriate to them. I do spend a lot of time doing different kinds of administrative stuff, such as research and participating in different societies to try to promote the care of children with disability. And so my days can be long, my week can be very busy. I tend to work on weekends and as well. But it's a wonderful opportunity that I have at Gillette, and I have a wonderful opportunity working with United Cerebral Palsy. It's busy, but it's well worth it.
All right. What are some of the newer treatments for children with disabilities?
So over the last several years, there's been a lot of exciting innovations that have been made that help children with disabilities and function better. One of the most exciting things is some of the genetic treatments that we have. So there's a lot of children that have disabilities because of genetic disorders. And in the past, we didn't have very good treatments for them. But now we have some genetic treatments in which we replace the gene that may be defective. And we also can replace some of the proteins that gene was supposed to make. And so there's all kinds of different gene therapies that are evolving now. And so children with muscular dystrophies, particularly for a muscular dystrophy called spinal muscular atrophy, and also for Duchenne's muscular dystrophy, there's some newer treatments that are out that have been helping immensely so that their lives are much better and they're much higher functioning than they did before. There's a lot of other different genetic disorders where we're seeing some genetic treatments, and it's going to continue to evolve. That part of medicine is exploding, and we're going to see a lot of different treatments that come out. Right now, that depends on the state that you live in, but children, when they're first born, will get tested for a variety of different genetic disorders, and now we have some treatments for them. It can be up into the hundreds that we check for. And at some point, and Shiva, maybe at some time in your lifetime, we might see where a child is born and they take a little drop of blood and they put it in the machine, and the machine spits out a genetic treatment at the end of it that you inject and you treat the child for it. We used to think that was fantasy, but we're getting closer. So at some point, we hope we get to that point. There are a lot of other treatments that are coming out. There are treatments that are coming out to help children move or think that can't control their body well enough to do that. So let's say, for example, you have a child with severe cerebral palsy that has good cognition, but they can't make their body move. So they can't even drive an electric wheelchair because they don't have enough control of their hands, or they can't communicate or talk because they don't have enough control of the muscles in their throat. There are different innovations of electronically and using computer and AI that are helping them do that. So, for example, there are some implantable devices that are just evolving. So it's really on these are very new and just on the cutting edge of some of the technology that we're trying to develop. But you can insert an electrode that will read the brain waves of a child and will help them to control an electric wheelchair and go where they want it to, or to replicate their voice or replicate a voice and allow them to talk just by them thinking. I was at a conference last year, and there was someone presenting a helmet that they had that had all these electrodes in it. And they had a volunteer to test this and help program this helmet. And they put on the helmet and they thought about different things like go forward, go to the left, go to the right, trying to think of how you would control a wheelchair. And the computer system read their brain waves as they had this helmet on. And after 10 minutes, they hooked it up to the wheelchair and they could drive it all around the room. It was crazy. And so there's different kinds of treatments and different kind of innovations that are coming out right now. We have stimulators that can be implanted in the certain parts of the brain that don't have that have been damaged, don't have the right type of electrical signals that are going through, and this kind of artificially stimulates some of the nerves and makes it easier for patients to move. None of these cure the disease, but they can make their lives a lot better. So this is, I mean, in my career, we're not going to see the fruits of all these labors, but hopefully, Shiva, for you, as you get older, you're going to see a lot of the fruits of these labors, and that are being developed right now.
Thank you. Can you tell us a little bit more about assistive technologies that are out there?
Yeah, so I'll give you an example. There's one that's being developed. There's a couple centers in the San Francisco, Oakland Bay area that are implanted that if using brain waves, and they have artificial intelligence learns how to read the brain waves. And so, for example, they'll have someone read a sentence like, I like sipping hot tea in the morning. I'm making that up, but I mean, they have various different sentences that they have them think about. And then the computer reads the brain waves that are trying to, as they're thinking about those sentences, and it learns how they want to talk and what brain waves they use to learn to talk. So you implant this electrode, and it's somebody that can't control their voice. And they had a woman that couldn't control her voice, and they implanted this device, and they replicated what she was thinking. Now it was only 1/3 of what she could say, but the computer, as she thought, the computer would speak for her. And they had some old videos. This woman had I think she had a stroke. They had some old videos of her wedding vows, and so they had her voice, and so they programmed the computer to sound like her voice, and so she actually was her voice as she was thinking about what to say. And so you're going to see more of these kinds of things that are coming out, and you can use them to control wheelchairs and to turn on the lights and do all kinds of different things. And so it doesn't make their lives completely and totally normal, but it certainly replaces certain elements of their lives that are very, very valuable to them.
Another question. What is lived experience research?
Well, lived experience research is involving people who are directly impacted by a medical problem when you're trying to put together a study. So when you do medical research, you try to ask a question, you try to figure out how you're going to design to answer that question, collect the data, and try to interpret it and analyze it the best that you can. Historically, we haven't included people that have that particular disease in the studies to know what's valuable to them, what questions do they want to be answered. And so now we're incorporating lived experience people in medical research. And what it has done, it has refocused what we for them, and it's actually come up with better results. I've been lucky enough to be involved in several studies in which we've involved lived experience people, and it's dramatically modified what we would have done, and it's come up with a better study and a better result and a more important impact on their lives.
All right. Can you tell us what led you to join United Cerebral Palsy?
Well, Gillette Children's is actually an affiliate of United Cerebral Palsy. It's the only hospital affiliate. And they were looking for a physician to be on their board. They had never had a physician on their board before, and they're looking for one. And they asked if I would be interested, and I was honored they asked. And so that's what led to it. And it's been a wonderful experience. It's been wonderful to advance the care of kids with disabilities and all people with disabilities. And so I've been honored to be a part of that board.
All right. Can you tell us what are some initiatives that you have done through UCP and Gillette?
I've been honored to be involved in an initiative with Gillette Children's and UCP in the early detection and intervention of children with a risk of having developmental disabilities. So this is for children less than a year of age. And so we have come together and worked together with other affiliates to develop a program to identify children who are at risk, who are infants, so that we can diagnose them as early as we can, and also to intervene and initiate therapies as early as we can, because the earlier you initiate therapies, the better their outcomes would be. And so that program has been going on for several years. I work with a therapist by the name of Valerie Piericini from Arizona, and Michael Kruer, who's a neurologist, pediatric neurologist in Arizona as well, and many other people and affiliates. And it's been a wonderful experience, and we've had a significant impact, and I hope we continue to have an impact.
All right. What advice would you give caregivers as hope towards caring for their loved ones?
Well, caregiving is very difficult. I mean, Shiva, you're a lived experience person with your aunt, and it is tough. It's trying on families. I'm a physician. I get to go home at the end of the day. I don't have to live with that 24 hours a day. And so we really don't have enough support out there for caregivers because of all the taxing nature of what they have to do. And so I would advise caregivers to find some assistance in programs that are in your community that can help in providing the kind of care that your loved one may need. And there are resources out there, whether it be through United Cerebral Palsy or your local hospital. And then Gillette Children's is an international hospital, and they can work can be a resource as well. But trying to find those resources in the community that can help you the best you can to care for your loved one.
Thank you so much for this informative session, and thank you so much for me personally for being on my podcast today. It means a lot to me.
Shiva, I want to thank you for inviting me. I also want to congratulate you and encourage you to keep doing what you're doing. This is a wonderful thing. I think the more that people understand about caregiving for people with disabilities, the better. So I encourage you to continue what you're doing. You're doing great work, and I'm honored to have been on your program.
Thank you.